We're going into the health segment now. This week or yesterday, we started a discussion on fibroids. We heard from state-registered nutritionist Akosia Yadom, running us through some of the foods that we can take to protect us from gaining fibroids. This time we want to look at the health bit itself, going into the dangers of fibroids, the causes, and of course some of the complications that may come out of it. And of course we have Dr. Owusu in studio with us, and he's going to run us through exactly what fibroids are, and then of course the dangers associated with fibroids. Good morning, Doc.
Good morning, Nana. How are you?
I'm great. You're looking awesome.
Thank you very much.
All right, Doc, so straight away tell us exactly what fibroids are, and then what are some of the complications they come along with.
Well, fibroids are non-cancerous, emphasis on non-cancerous tumors or growths that occur in the womb of a woman.
Right.
Obviously, it's only women that have wombs, so it can only occur in the womb of a woman. It's very, very common. In fact, if you took 10 women off the streets right now, about 7 of them will have a fibroid.
Right.
And because now there are a lot of places where you can just go in and have a scan done, we are diagnosing fibroids more often now, not because the incidence is increasing, but because more people are becoming aware of them.
Right.
And so that's one of the reasons why it's important to know about them, because there's also a lot of misinformation. I mean, I've heard things like it's your blood. If you have your menses and the blood doesn't flow well, it will congeal and enter the womb and become a fibroid. Okay. Fibroid is not related to blood in any way. Okay. It's not a blood clot. It's not any blood products, nothing. It's a growth that happens during the reproductive age. In other words, if the woman is beyond reproductive age, if the woman is menopausal, she will not have a new fibroid developing. So those are some of the things that we need to understand about fibroids. Now, when it comes to the symptoms of a fibroid depend predominantly on the location of that fibroid. Okay. So if the fibroid is located in the lower part of the womb, it can actually sit on the bladder and cause you to urinate more frequently. If the fibroid is quite big, it can cause some pain, some discomfort. If the fibroid is located in the mucous layer of the womb. Now the womb has 3 layers. There's the middle layer, the inner layer, and the outer layer. The fibroid usually starts in the middle layer, the muscle layer. The middle layer is where the muscles are, the muscles that push the baby out of the womb. Okay. That's where the fibroid develops from. So it can develop in the portion closer to the inner layer, or in the portions closer to the outer layer. When it's closer to the inner layer, it can affect your chances of conceiving. But the fibroid by itself does not affect your reproductive chances. But if it's located close to the inner layer, it can reduce your chances somewhat. And so that's why if a woman is having difficulty conceiving, one of the things that the doctor would look for would be, is there a fibroid, a submucous fibroid? We have an image
on the screen. If you can run us through it and then tell us exactly what we're looking at.
All right. So those brownish things are representing the fibroid. Right. So you notice that all of them are in the middle layer, the muscle layer. So you can have the fibroid just being in the muscle layer, and that's it. In which case it's called an intramural fibroid. Okay. If the fibroid is closer to the outer layer, we call it a subserosal fibroid. Now, this subserosal fibroid can grow and become pedunculated in the sense that it sort of falls outside the womb. Okay. So when it comes to treatment, it's actually, you can actually easily go and nip that one off, and you're fine. Then we have the submucosal fibroid, which is the ones that are closer to the inner layer. And because they are closer to the inner layer, you know that pregnancy or the fetus, it implants in the mucous membrane. Right. So because the fibroid is so close to the mucous membrane, it can affect that implantation. And so that's why I was saying that if a woman is having challenges with conception, one of the things that the doctors will look for would be a submucosal fibroid. And if it's there, they will remove it. But generally, the fact that you have a fibroid does not mean you cannot have children. There are so many women who've had children and had fibroids at the same time.
Okay. But how dangerous are fibroids?
So most fibroids are actually not dangerous. In fact, if not for the fact that women were going to do scans, you would never know you had a fibroid.
Okay.
And so most fibroids were actually asymptomatic. But occasionally you have a fibroid that may grow too big and start showing symptoms, or depending on the location, it can cause you to bleed excessively during your menstrual period. It can cause you to have pain. It can cause you to urinate more frequently. Okay. So these are some of the symptoms you notice. But in terms of danger, by the fibroid itself, most fibroids do not pose any health risk, except for the few that would give the symptoms I've already listed earlier.
Right. All right, Doc. So Nana Konamah is a survivor, if I can put it that way, and she has been running a campaign breaking the myth on fibroids, and she's joining us via Zoom to share her story with us, and so we want to bring her into the conversation. Hello, Nana.
Hello, how are you? Thank you for having me.
Great. How are you?
Awesome. Very well, thank you.
Right. So tell us about the My Fibroid Story campaign. What is it about, and then what are the plans you have towards it?
Absolutely. So my fibroid story really was born out of my own journey with fibroids. And I really sought to break the silence, because when I had fibroids and I was dealing with my situation, I realized that the research wasn't robust, and the information just wasn't plenty. There wasn't really a lot of resources to get from. But one thing I noticed was that by talking to one another, since there's so many women, especially African women, who have this problem, by just talking about fibroids, I learned so much, and I was able to also give a lot to other people. So really right now we're focused on building awareness on fibroids.
Okay, great. So how long have you been doing this?
I launched this last year after my fibroid surgery, which I had last July. And I launched my fibroid story last year. I filmed a small documentary between myself and a very good friend of mine, Jessica Nabongo, who was just finishing up her worldwide journey as the first Black woman to visit every country in the world. And we sat down and we had conversations about both our journeys with fibroids. So there was a campaign last year, and then there's a campaign this year as well.
Great. So what's the relationship between the fibroids and then the menstrual cycles? Because as part of what you're doing, you're seeking to break a myth surrounding the menstrual cycle.
Well, I'm seeking to address period stigma. What we notice is that period stigma is basically sort of like a negative cloud around periods. This means that when there is stigmatization around periods, and that means we're not talking about periods. And if we're not talking about periods, that means that we're not talking about our reproductive cycles. We're not talking about issues that might arise in our reproductive cycles. And one of the major symptoms of fibroids really is heavy periods, right? Like usually fibroids show up, the pathology shows up somehow in your period. So it's important that we are comfortable enough to even speak about our periods to begin with, to even begin to understand what issues may arise.
All right, I'm going to bring Regina J. Frimpong also into the conversation. Now, Regina has done a hysterectomy, and so she's also going to share her experience with us. Hello, Regina.
Hello.
How are you?
I'm fine.
Great. So tell us, what was the experience like having to go do a hysterectomy, and then after, how have you been?
Oh, maybe my fibroid symptoms there. No one said me last 2 months, me menstruating, now me bleeding plenty. So I went to the hospital and told my doctor, and they scanned me, and they say I have small fibroid. Okay. And they say they will look it for me. Now, my work too, intimate, I say, okay, then I will do it. Intimate, last Friday we are. Now, my doctor no, ma'am, it's very easy. Okay. So now I'm fine.
Okay. Well, Doc, let's draw that relationship there with fibroids and then, of course, periods. What's the story behind that?
Okay, so I mentioned that there are different locations of the fibroid. So when you have a fibroid, especially the submucosal fibroid, the one that comes into the lining of the inner lining of the womb, it increases the surface area. So if previously your surface area was, let's say, this big, now the fibroid comes in there, it expands that surface area, so the surface area becomes much bigger. Now, when it comes to period basically is the shedding of the inner layer of the uterus or the womb.
Right.
And so if the surface area has increased, obviously means that you're going to have a lot more bleeding points. And so that is why submucosal fibroids will cause your periods to become heavy. And so as the first lady said, and even Regina as well, you notice that if you have submucosal fibroids, your bleeding becomes heavier.
Okay.
And sometimes it can go beyond 8 days, sometimes 2 weeks, and that's one of the, it'll tell you that there's something going on. You go and do an investigation, you realize that it's a fibroid, and most likely a submucosal fibroid.
Right. And then the process of correcting this is the hysterectomy?
Not all the time.
Okay.
So as Regina said, she's already had 2 children. She's okay with her family size. She doesn't want to go anymore for any more children.
Okay.
So she opted for the hysterectomy, which is the removal of the womb entirely.
Okay, this removing the womb entirely.
Exactly.
Wow.
So that she doesn't want to have children anymore. She's done. So they remove the womb. So that's one way of dealing with fibroids. Depending on your age, it's one of the options available. Okay. But if Regina was not ready to stop childbirth, if she wanted to have more children, then hysterectomy would not have been the option for her. So they would go in and do a myomectomy. Where they would go and target the fibroid and remove those fibroids that are visible at the time of operation. Now, emphasis on visible at the time of operation. Yeah. This is because a lot of the time, women have surgery for fibroid. Then, in the future, they have another fibroid. Then they say the doctor didn't do a good job. Yeah. It doesn't work like that.
Okay.
So
that's more like the issue with the hemorrhoids.
Exactly.
Okay.
Exactly. So when you do an operation for fibroid today, the doctors would go in and remove what they see today. But once the uterus is still in there, once your muscles are still there, another fibroid can grow. Okay. And so that's why one of the recommendations for fibroid is that we don't act on them too early, except it's causing symptoms. Okay. So if it's not causing symptoms, most doctors recommend that you leave it there until you are done with your child, your family. Then you can come in and opt for a hysterectomy.
Okay. Now let's go back to Regina. Regina, were you given the various options and then you chose to go for the hysterectomy?
Yes, please.
Why?
They said they can give me medicine for the blood to stop. And I said I have to, and I'm old enough. I'm 47.
Okay.
So I think I will move on and I will be free.
Okay. So you can have your freedom from fibroids.
Yes.
Awesome.
Yes.
Awesome. Let's go back to Nana Konamah. So, yes, July is more like a Fibroids Awareness Month. What are your plans?
So for July, we've been actively, it's been a primarily digital campaign on my social media and as well as my website, speaking about fibroids and also releasing informational videos about fibroids, fibroid management, fibroid treatment, how to manage fibroids, how to eat for your fibroids, right? Because there is definitely a wellness component in there, as well as every Friday we have Fibroid Fridays where we have different in-depth conversations with different professionals, women who are specifically working in reproductive health. The reception has been incredible, and we're also sharing other women's stories via the hashtag #MyFibroidStory.
Right.
The reception has been incredible, and it's really been beautiful just how much information is being shared just through people's stories. I mean, it's been immense and almost overwhelming, but like in a really good way.
Right. Now, talk to us about uterine fibroids. You think there's not much information about it out there?
It's not what I think. In fact, we know that there isn't a lot of robust research into the area. And part of the reason, I believe, is that it is an issue that is not considered as a health priority. If you go to the WHO website and go to health issues by region and by gender, fibroids are not even listed on the WHO website. And fibroids are the most common affliction or common health issue that women experience. And so it makes me wonder, well, why is it not prioritized, on a global scale or even on a local scale, right?
Right. All right. Thank you very much. Nana Konamah is founder of My Fibroid Story. She is on the Fibroid Awareness Campaign. Let's come back in studio and talk to Doc. Doc, so basically, should we be scared about fibroids? Should our women be scared about fibroids?
Well, I mean, I think when you're a woman and you are diagnosed as having fibroid, it's a period of uncertainty. It's a period of, I mean, it's confusing because, as Nana has already said, there's a lot of what's it called? There's not much information out there for people. You know, a lot of the medical, a lot of information contains a lot of medical jargon, so it needs to be broken down further for the average person, average woman to understand what's going on. So it can be a period of confusion, you know, and also because, as I mentioned earlier, there's a lot of misconception out there. I mean, you sit in a trotro on a daily basis, people are selling all sorts of remedy for fibroid, you know, and it causes more, and you take these medication, you take these things, and it causes more harm. And so it's something that most women don't want to ever be diagnosed with, even though it's quite common, like, as I mentioned. I mean, up to 70% of women walking around have some form of fibroid, whether it's small or big or in between, you know. And so definitely it's something that a lot of education needs to go out about. But in terms of scary, it is not exactly scary, you know, because you it's not something that will kill you if you actually go through the right treatment modalities, you know, because as I mentioned, first of all, not majority of fibroids are not going to cause any symptoms at all, you know, and so you actually end up diagnosing fibroids post-mortem for a lot of women. But if it is causing symptoms, you have to get the right medical help, not taking all sorts of medications and concoctions out there, which could end up giving you other complications, you know. And so once it's causing symptoms, it needs to be worked on.
Right. All right. Thank you very much, Dr. Owusu, with that information there on fibroids. Earlier, we're joined by Regina J, who is a trader, and she has gone through the hysterectomy to remove her womb because she had some issues with fibroids. And then, of course, Nana Konamah also joined us via Zoom. Now, she is on a campaign to educate women about fibroids, and so she's doing some amazing work out there on social media.
Hi there. We hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.